Messieurs les présidents, mesdames, messieurs les ambassadeurs, mesdames, messieurs,
Chairs, presidents, ambassadors, ladies and gentlemen, it's a pleasure for me to be here with you today to talk about a subject which is a bit more than what I've been talking about, what was just mentioned, because the WHO is going through innovation and the new strategy was adopted last week at the World Health Meeting, and this is in line with your concerns for innovation in healthcare and also for reverse innovation. We talk about turning the pyramid upside down, the usual pyramid upside down, and focusing on the countries, and I think we are in line with that.
Je vais essayer d'utiliser ce dispositif correctement pour passer mes diapositives.
I'll see if I can get this device to work, but I'm not sure that I can. So what are the objectives of the World Health Organization and what are the priorities that we have today? There are three main objectives. First, we want to promote health, keep the world safer, and protect the most vulnerable people around the world. Now, I would like you to do a bit of an exercise. I'd like you to imagine what the world might be like in 2030. So I'll just give you a moment to think about what the world might be like, what sort of innovations, changes, or progress will be made by 2030. What could you think of? Well, if we're going to have all this change and innovation, if we want to transform our vision and our vision of healthcare and development in general, perhaps we could imagine that there would be no more epidemics, such as we've had with AIDS, tuberculosis, or malaria. We might always imagine that you could live longer with better prevention and better treatment of diseases such as cardiac disease, cancer, and diabetes. You could also imagine a world where everybody would have access to healthcare at affordable prices, and that would mean having access to essential medication and vaccines. You could also imagine a safer world because countries would be better prepared to respond to national disasters and health disasters, be they national or global. The WHO has a central role to play here so that this future can become reality, so that we can help countries develop through innovation, of course, but also through commitments made. Political commitment needs to be greater so that we can achieve the Sustainable Development Goals. The WHO is committed through the Sustainable Development Goals. Obviously, there is number 3, which is for us all to live in good health and have well-being for everyone at all ages. But also, in general, we need to look at the intersectoral approach of all these objectives, because these are Sustainable Development Goals which are coordinated, they're interdependent, be it the eradication of poverty or the implementation of democracy and rule of law. This all helps us have better health care, better innovation, and quality health care. The WHO was recently asked to play a coordinating role of getting all the healthcare players together so that we could have greater success in achieving SDG number 3 and the other health-related facts in the other goals. And this was done through a letter written by the Chancellor Angela Merkel and Prime Minister Solberg from Norway and the President of Ghana, who asked us to build a partnership for a global action plan so that we could have better coordination and more efficient work together so that we can find innovative solutions and achieve these goals for 2030. So we're starting up on this cycle, and of course we know it's hard to keep up with the rate needed to achieve the goal by 2030. And the Secretary General of the United Nations has just confirmed this duty we have and has asked the WHO to play the role in structuring and innovating so that we can achieve the Sustainable Development Goals, and in particular those related to healthcare. So what is the WHO strategy? What are the duties of WHO and how will its role be played on these issues? I would say that today, despite progress which has been made in achieving the Millennium Development Goals, we still find the world population is threatened by a number of problems affecting healthcare and well-being, and this can go from inequality, conflict, contagious diseases, and we can see there are more and more contagious diseases going onto the list, and more than half the world does not have access to proper health care. Either have to have extensive financial output or they have other problems. And when you look at the situation around the world with epidemics, pandemics, conflicts, natural disasters, technological disasters, and so on, and other phenomena such as microbial resistance, we know that there are more than 244 million people last year migrated from their home countries for reasons related to these development issues. So WHO has its constitution and has its role to play in international healthcare so that we can work together in a more structured way on issues related to health and get all efforts coming together. The WHO, with the new Director General, Dr. Pedros, who has got a real change in the strategy of the organization with his vision of the role of the organization, and we have a new working program which is a 5-year strategy for the organization, and it's based on the Sustainable Development Goals. And that is based on what you can see here. It's what we call our triple billion. It's not 3 billion, but you can see that the billions overlap. You've got 1 billion more people have to have health coverage, universal health coverage, because this is required through better healthcare systems. We need to have 1 billion people with safer coverage from health threats, and we want 1 billion people whose lives are improved, who have better well-being through better health care. So how can this be done? Here you can see the explanation of the new WHO program and how it's going to work. First, we have our missions, as we call them, which are stated so that the role of the WHO is clear. We need to promote health, we need to have better security around the world, and we need to protect vulnerable populations. To do this, there are 3 key strategies, priority strategies, which I've just described. These are the 3 billion strategies that I presented on the previous slide. And we also make it possible to have major strategic changes. First, we need to have improved world leadership and advocacy for healthcare based on gender equality, equity for healthcare, and of course human rights. So this is multi-sectoral approach that's needed, and we need to have access to public assets around the world. The impact is not just a question of guidelines and directions, but we need to see the results and we need to assess the results and measure them. And the WHO has set down the type of dialogue that can be done with all countries so that we can improve the impact of public health care and everywhere. And this covers the most mature healthcare systems where we need to have political dialogue and look at what's going to happen in the future and pool our ideas together so that we can have an innovative approach for new healthcare systems and new priorities and new technologies which will help us improve healthcare systems so that we can then go down to the most fragile systems with specific countries where we have to have a strategic approach building up higher performance healthcare systems. Some countries will need technical assistance so that they can set up the national institutions they need. And in some countries which are very vulnerable, we will need to be in a position where we can provide services to offset critical problems and emergency situations. For example, setting up vaccination programs for cholera and diphtheria in Yemen, and obviously the local authorities in Yemen cannot deal with that. So we need to see what organizational changes are needed so that we can measure what's going to be done and so that we can measure the impact. We need to have data collection systems, we need to have targets and indicators which are very clear. We have to change the operating model so that we can have an impact at every every level. The WHO is not just in Geneva, it's also in regional areas and in country areas. And the Director General, Dr. Pedros, wants to change the pyramid, turn it upside down so that the countries are the central of WHO policy, so that resources are there where they are needed the most. In other words, in the countries, at the country's reach. So this is the pyramid upside down, which is in line with your priorities to reverse. And we need to transform partnerships. We need to change our communication and our resources so that we can really support our strategic priorities. We need to strengthen healthcare systems and the systems and the processes which are the most critically needed to improve performance. And we need to have a cultural change, not just for the organization, but in the dialogue with all our member states. And that is no doubt what is the most time-consuming exercise and the most difficult part of the exercise to be achieved. Perhaps I can just say a little bit more about the 3 billions that I mentioned, the 3 strategic lines which we have for our priorities at WHO. And this approach of WHO is consistent with the key duties it had in the past, the essential functions it had to play a key role in the essential role of healthcare and establish partnerships for action which is needed, establish priorities for research and encourage the production, application and dissemination of knowledge which is relevant. We need to set standards and criteria. We need to ensure that they are enforced, set down policies in line with proper ethics based on proven evidence. We need to have proper techniques, and we need to move for change and have sustainable support for institutional capacities and make sure there is proper surveillance of health situation and see what trends are developing in healthcare. So we still have those duties. What the WHO will be doing, obviously, is to work on the Sustainable Development Goals and what it can do to strengthen that, and particularly for 3.8. And in general, for Goal 3, we need to have a better universal healthcare coverage, and that can't be done if we don't work on national strategies and provide solid support. We need to strengthen national healthcare systems and develop innovation and build up systems which are based on the person concerned. In that area, there will be 5 priority sectors: access to quality healthcare, improvement of healthcare personnel, in other words, greater skills and competencies, better training, have better delegation of tasks and duties. That's a key issue. We need to have proper guarantee of access to pharmaceuticals, treatment and healthcare. And we need to have better governance and management by improving local capacities so that there can be local health services provided, and don't find a situation as we do now with 100 million people under the poverty line because they cannot afford healthcare. And we need to have better health information systems with reliable quality data, and innovation is a key element to achieve these goals so that we can work in a different way and have more effective achievement of all the goals. I see that I have very little time left, so I'll go on to the next slide. And here we have health emergencies. We have to have 1 billion more people better protected from health emergencies, and the WHO priority is to have national, regional and global capacities that are resilient and able to deal with health emergencies. And we have to make sure that all the populations affected have swift access to essential life-saving services, and this includes promoting health and preventing disease, and we need to use the most innovative technology to do so too. You can see that these 2 priorities are the 2 sides of the same coin. We're improving the healthcare systems and dealing with health emergencies. These are interrelated and highly important issues. And we obviously have to promote healthier populations. We have to reduce risk factors health and do so through a multi-sectoral approach. And we have to focus on key determinants of health and make sure that no one is left behind and have better health promotion. We will be doing this in different ways. We're going to look at human resources, human capital. Mr. Benamou mentioned this. We need to look at that. We have to have prevention of non-contagious diseases, non-transmitted diseases. We need to eliminate transmittable diseases such as tuberculosis, HIV, and malaria. We need to look on the question of microbial resistance, and we have to counter the effects of climate change on health. This is a key issue. So for all of that, WHO is defending healthcare at the highest policy level and is constantly pointing out, our Director General is always saying this whenever he has political discussions at every level, that healthcare is not an expenditure, it is an investment. It's an investment in the future, and political commitment is essential, and the world cannot just sit back and not invest in healthcare. Thank you.